Hello, everyone. Thank you for joining us today. Today, we're going to talk about the benefits of omega. Most of the slides are provided by our partner, Neptune. So, if you look at the literature out there and the number of clinical trials performed on different supplements, omega-3 is one of the most widely studied supplement with over 3,800 clinical trials. Second to vitamin D3. And the other ones that you may have encountered, such as acetaminophen, which is Tylenol, or vitamin E, um, folic acid, and ibuprofen. And with these clinical trials, there's so many of them because omega-3 has been indicated to have benefits in various different disease conditions in terms of treatment or prevention. And today we're going to only focus on a couple of them. The first of all is cognitive health. As you know, as people age and also as a child developed, the development of the cognitive system is very important, and it's very important to keep our brains healthy. So omega-3 have been shown to help support the cognitive health and brain function. It also helped the development of the brain and the eyes, which is an extension of the brain, in children up to 12 years of age. And many of the milk formulas, DHA have also been added because DHA has been shown to maintenance of brain health and also maintaining normal vision. And in children and adolescents with ADD or ADHD, omega-3 has been shown to help them improve the concentration and focus of these children and to make them more calm and focused. In addition, in terms of cardiovascular health, we know that it's very important to keep our blood vessels healthy and our hearts healthy because our vascular systems is responsible for bringing oxygen and nutrients to all our tissue in the body and to help eliminate and removal of the waste products. So keeping the cardiovascular system healthy, it is important and it's valued in terms of the overall health of an individual. And people with high triglyceride or triacylglycerol, omega-3 has been shown to reduce the blood level of triglyceride. And DHA and EPA has been shown to contribute to the maintenance of normal blood pressure. Thirdly, pain and inflammation is an area of interest to many people, especially with osteoarthritis or people with rheumatoid arthritis. Numerous trials have shown that omega-3 in conjunction with conventional anti-inflammatory therapy have been shown to reduce pain and improve quality of life of these individuals. So why do we have to supplement omega-3? And in our typical modern day diet, there's an imbalance of omega intake. And many of the deep fried or other or the meat that we consume rich in omega-6. So in essence, we're having a imbalance of too much omega-6 and not enough omega-3. And in a more ideal omega diet, we want to have sort of more or less similar levels of omega-3 and omega-6 to make sure that the inflammatory response is not overly activated. So there are two ways that we can achieve this goal. Number one is to reduce our intake of omega-6, but to a certain level. And also at the same time, we try to increase the intake of omega-3 fatty acids. So how do we know if we are having enough omega-3? And there's a omega-3 index that can help us sort of to assess and to sort of gauge how much omega-3 we have and are we taking enough or should we take more? So what is this omega 3 index is the measurement of EPA and DHA in red blood cells. And that sort of signifies as a marker of the omega 3 in the tissue level. Red blood cell membranes, the membrane of red blood cells are um, incorporate many of the fatty acids that we consume in our diet, and the average life of a red blood cell is about 100 to 120 days. So measuring the omega level of the red blood cells would give us a pretty good idea of the type of fatty acids that we have in our body. It is kind of like the hemoglobin A1C that many of the diabetic patients would measure every 3 months to get an idea of their um, blood sugar level. That's quite a similar analogy. What omega 3 is doing, but is looking at the fatty acids in the red blood cells. And this EPA and DHA levels, um, and measured in omega-3 index, um, it's important because that it shows the balance of that in terms in the with the omega-6 arachidonic acid as a marker of pro-inflammatory sort of response. So having a high omega-3 index would kind of suppress or keep the pro-inflammatory pathways to a manageable level. So what is the ideal omega-3 index? Numerous have studies to show that to get good protection, we want to have over 8% of or in the omega-3 index. And with anything less than 4%, the protection is very little to none. So what we really try to achieve is that to get our omega-3 index to about 8 to 10%. And why is this percentage important? Because sources have shown that the increase of the omega-3 index reduce the relative risk of sudden cardiac death. So if you look at the graph here, that in the value of less than 4% of in the omega-3 index, say that the relative risk is 1 as the baseline. If we increase the omega-3 index to 8% or more, it offers a 90% reduction of the relative risk of sudden cardiac death. So because the omega-3 such index such a powerful tool in sort of seeing our risk of cardiac death and other vascular and potentially other vascular complications, are we reaching it? Are we getting to a level that offers us a good protection? From a research that's been done that on in the US cohort is that the average omega-3 index is about 6% for most people, and 82% score less than 8%. So in the population, about 4 in 5 people um, does not reach the omega-3 index of 8% or more. As fish is a rich source of omega-3, as we can see that having more fish in our weekly meals would help increase the level of omega-3 without supplements. And obviously, with the additional supplementation, it will help reach a higher um, percentage. So for people that, and also depending on the number of times of people eat fish, the amount of supplementation may vary. So so that when you look at the how much omega we should take, it should be a combination of how much omega do we take in our diet, and we have to complement it, supplement it with um, additional supplementation with omega-3 fatty acids. So how likely are we able to reach this percentage if we kind of looking at, well, if we don't take the supplements or take supplements? If we're having uh, people who never eat fish, the percentage with over 8% is like 2%. But with supplementation, it's easily reached to over 25%. And people who like eat fish 2 to 3 times a week, the supplementation would significantly increase their percentage to about 40 to 40%. So almost like 1 in 2 people um, who eats fish 2 to 3 times per week would have um, an omega-3 index of greater than 8% if they're supplemented with additional omega-3 um, supplements. So we eat 3 times a day, 3 times a week, and like, why don't we just eat more fish? Would that solve the problem? So we don't have to take any supplements and omega. The problem is that in our oceans, there are many places with pollutions and contaminants in our food chain. Things like such as mercury, heavy metals, and other things, and other environmental toxins in our food system. So taking of more fish itself, it may help us increase the omega-3, but at the same time, it may increase the risk of ingesting more toxic substances. And so why is it so difficult to reach that high percentage? And if we look at the biochemistry of omega-3 fatty acid, it basically is an oil. And if you put oil in water, you can tell that it's immiscible, that water and oil don't really mix well together. But our body is wonderful, has wonderful design to help us absorb these fats. And normally, the fat needs to be emulsified um, with biosalt that's produced by our liver. And these biosalt would emulsify the large lipid droplet into smaller micelles, which would greatly increases their surface area, which allows our enzymes to have access to the molecules and free up the fatty acids, and so that our cells in our intestinal mucosa could absorb them. And if you look at the absorptions efficiency, we typically absorbed about 20% of the EPA and DHA in ethyl ester forms, and less than 65% in the triglyceride form. So now we turn to why we take omega in the allicin form. And the omega, allicin omega, the source of that is not fish oil, not in the triglyceride form, but in the phospholipid form. And phospholipids helps emulsified in the digestion process, and have increased absorption with other fat soluble nutrients such as EPA and DHA, and other antioxidants such as astaxanthin, lutein, coenzyme Q10, and vitamins such as vitamin D and vitamin E. And so phospholipids would be very different from regular fish oil in the triglyceride form, that the lipid-soluble nutrients, uh, it's accelerated. It's easier to going through the step 1 to 3 in the digestion process, so that it increases, that's one of the mechanisms, how it increases the bioavailability of the supplements intake, how we can actually take, our body actually can take more and be able to absorb more of these nutrients that we would like to have. And many studies have shown that the omega-3 in the phospholipid form containing krill oil would increase the omega-3 index that we talked about earlier um, more than twice as much as the regular omega-3 that we normally see. And because our brain is mostly fat, with six or about 60% fat, and it's the most important form of omega of fatty acid is the DHA. And the passage of fatty acid into the brain is restricted to omega-3 essential fatty acids and phospholipids, and have been identified as a key transporter of DHA into the brain. And this is one of the reasons why omega-3 in the phospholipid form is in breast milk. As the baby takes the milk, a lot of the phospho in omega-3s is able to go into the brains of the infant to help with his or her brain development. And other naturally occurring um, antioxidants in the krill oil in our omega-3 is that's a rich source of astaxanthin. Astaxanthin is an antioxidant that help protect our cells against oxidative damage caused by free radicals. It also helps reduce the level of C-reactive protein, which is a clinical marker of inflammation. And it also promotes eye health, reduce eye strains, and fatigue. So omega-3 not only protects our make our brain helps our brain function, also the extra antioxidants to would help our cells from the effect of oxidative damage. Um, the krill oil have been also shown in many of the women to reduce the symptoms of premenstrual syndrome. We've already covered that. It helps to maintain cardiovascular health. As an adjunct therapy, it helps with conventional cholesterol lowering statin therapy to reduce triglyceride, the low density lipoprotein, and to increase the high density lipoprotein, HDL, and helps to reduce uh, pain associated with osteoarthritis as a summary. So, how can we reach our goals of 8% or more um, in addition to our regular diet? So currently, based on the calculation, and so we recommend that taking 2 to 3 omega soft gels per day offers moderate protection. And if you really want to achieve even high level, or if you don't take any, not having sufficient omega-3 in your regular diet, taking up to 6 to 8 omega gels can help you achieve this effect. So thank you very much for joining us today, and we'll see you later.